Telemedicine in Emergency Departments, April 9th, 2017. University of Maryland, University College, for Professor Patrick Malone. What is telemedicine? Telemedicine is the use of audiovisual, computer, and other technologies that allow doctors to provide medical treatment from a distance. Telemedicine is similar to teleconference provided by services like Skype or Apple's FaceTime. A nurse will assist with the physical examination of the patient for the doctor. The doctor, who is located at the other end of the teleconference, will observe the examination of the patient. This is an example of telemedicine at work. You can see the nurse using the otoscope to examine the patient's ear. A video of the examination shows both on the doctor's and the nurse's monitors. The doctor is visible to both the patient and the nurse, and the doctor can give any further necessary instructions to the nurse at this time. The Affordable Care Act of 2010 resulted in 20 more million Americans having health care coverage. Now we're seeing more patients utilizing the emergency departments as one would typically use a primary care doctor. This causes overcrowding in emergency departments. Overcrowding is defined as when the number of patients waiting to be seen, combined with the number of patients already being seen, results in the capacity of the staff and/or number of beds in the emergency department being exceeded. The results of overcrowding in emergency departments include extremely long wait times for patients and patients leaving without being seen by a doctor. Other problems in emergency departments include a shortage of physicians for rural emergency departments. Rural emergency departments are staffed with doctors not specialized in emergency care, and rural emergency departments lack specialists needed for the proper care of stroke patients. Some solutions for emergency departments include telemedicine, allowing one doctor to be leveraged among multiple emergency departments. By having additional doctors via telemedicine, more patients can be seen, wait times decrease, and less people leave the hospital without being seen. More solutions for emergency departments include rural emergency departments receiving multiple benefits from telemedicine. They have specially trained emergency department nurse practitioners. These nurse practitioners will treat the lower acuity cases by themselves, and the higher acuity patients have the benefit of seeing a doctor via telemedicine with the nurse practitioner. Rural emergency departments have access to specialty doctors like neurologists to assist with stroke treatment. Telestroke prevents the transfer of a patient to a farther away hospital when time is critical. Telestroke allows a nurse to administer RTPA, or recombinant tissue plasminogen activator. External factors and telemedicine. Payment for telemedicine varies across different insurance companies. Medicare has a limited number of codes that can be used to bill for telemedicine. Medicaid payment for telemedicine typically varies from state to state. Telemedicine doctors are licensed in the state in which they normally perform care. Only 17 states have made it easy for already licensed doctors to obtain a license in their state. Other states have their own regulations regarding telemedicine. They will vary from state to state. Health information technology leaders' viewpoint. The leaders feel that they need complete buy-in from all the staff performing the telemedicine care. They expect the same high-quality level of service as any other patient would receive, and they are happy with the lower waiting times for patients that are provided by telemedicine. Health information technology leaders had concerns about the patient's point of view, especially those of the older generations, concerning telemedicine. Counter to their intuition, they've found that patients are embracing the technology, especially those of the older generations. As an added bonus, they've found that they have higher productivity and lower cost, as one physician can cover up to 3 emergency departments during that physician's shift. This is a diagram of the hub and spoke model of telemedicine. The design is like that of a wagon wheel. The teledoctor is located at the center or the hub of the design, and the emergency departments are located at the end of the spokes. The hub and spoke model of telemedicine has the teledoctor at the center of the hub and spoke design. The teledoctor is in high demand and short supply. As shown in the previous diagram of the hub and spoke design, the teledoctor can service multiple emergency departments during the same shift. The hub and spoke model of telemedicine will require business class internet access and Wi-Fi. It will require high definition video cameras. The camera supplying the doctor's vision should have a high capacity zoom feature that could read the small print on an IV bag. Recommended computer requirements for the hub and spoke model of telemedicine include an Intel i7 processor or newer, 16 gigabytes of RAM, a 1 terabyte hard drive, and a large television can act as both a monitor and speakers for the telemedicine conference. In order to perform the telemedicine visit, specialized medical instruments will be required. The stethoscope will relay the sounds of the heart and lungs to the teledoctor. Likewise, the otoscope will have a camera on it, and the doctor can virtually examine the ears, nose, and throat of the patient. There are multiple methods that the hospital can get the equipment that they need. They could utilize current vendors in most of the cases. Otherwise, there are companies that specialize in telemedicine, such as AMD Global Telemedicine, who advertises themselves as the future of medicine now. The end users of telemedicine. The teledoctor is at the hub and is the central and most integral user of the telemedicine hub and spoke design. You also have the nurses that take vitals and assist the teledoctors with the telemedicine examination. Then there are the nurse practitioners who assess and treat lower acuity patients, and they consult with teledoctors as needed on higher acuity cases. The opinions of the end users, or the doctors, nurses, and nurse practitioners. They go into their professions because they want to take care of their patients. Telemedicine allows them to take better care of their patients, and for this reason they're pleased with the results of telemedicine. Telemedicine's impact on patients. Patients at overcrowded hospitals are given the option to be examined by doctors via telemedicine. Patients are happy with the lessened waiting periods. Patients view the technology as a beneficial means to getting the treatment that they so desire. Patients are satisfied that they have access to doctors via telemedicine that the local small hospitals could not otherwise provide. Patients receive necessary care via telestroke that they otherwise may not have received in time to avoid further complications of their conditions. What is the value of telemedicine? Telemedicine offers a means of leveraging one doctor to take the place of multiple doctors during a shift, leading to increased financial performance for the hospitals. Telemedicine makes it easier to find extra physicians at larger hospitals during periods of high demand. Telemedicine also makes it easier to find staff at urban hospitals, as most urban locations have more amenities and the jobs have higher prestige for the doctors. Rural hospitals have access to specialists that they otherwise would not have the access to. They also like the lower cost of not having to employ a physician on staff. They have the ability to retain more emergency department family nurse practitioners. And most importantly, telestroke provides critical care from specialists to patients during their time of need. The end. Thank you for taking the time to listen to this presentation on telemedicine.